Okay, so I encountered a little hiccup. Um, there's nobody here to let us into the room, so I didn't have any of the um, those swabs that we were supposed to use instead of the ones that are in the kit. So I'm gonna pick up from there. I found some. Someone gave it to me from their kit. So I'm hoping that this is gonna be okay. So my partner's here, I'm here. She has the flashlight, he, she. And I will just start from here. Okay, so I'm going to open this away from me. And I can touch this an inch around, and I can turn it. I do not want this to touch my patient. I'm going to take my gloves off and grab my sterile. Okay, so I want to touch the inside of the glove, not the outside. Tuck my finger in. Okay, I'll leave it. And I can touch here. And I will keep my thumb tucked so I don't incorporate. Okay, and leave it. I'm going to use the sterile field. Didn't put it in the trash. I'm going to put this down. I want to make sure I'm not going to touch the patient with my gloves. And I have that inch border. Okay, so I'm going to get rid of the iodine and the lube. And I'm going to replace them with these swabs. I'm going to put them on my field. This will be for the catch if I need to get a clean catch. Okay, I would open up my lube, put it in there, but being that we don't have it, I have to use this. Okay. Alright, so I'm going to get this all ready. I'm going to check my balloon. I'm going to see if there's any holes, leaks. No? Okay. And then I'm going to let the water come back into the syringe. Okay. I'm going to put that in there. Okay. And then I'm going to wrap this. And I'm going to put it into the lube. Drop it. Maybe. Okay, there it is. Okay. Okay, so I have that ready. All right. So now I'm going to take my non-dominant hand, lady of back, one swipe down, through, towards me, all the way down, through, and then the middle, through. Okay, I do not want to let go of this. I need to keep it sterile. Okay, I'm going to bring this over and I'm going to put it in my field. Careful not to touch any of the skin. Okay, and then please take a deep breath, and I'm going to be pushing it in. I will push it in, and when I start seeing urine, I will push it in a couple more inches. Be careful not to touch my hand, my sterile hand, to the vagina. And then I'm going to let go, grab. And I'm going to put the water in the balloon. Okay, at this point I can take my hand off, make sure it's in. Okay. Okay, so at this point I would attach this to the leg. I would make sure that there's room so that way when she moves around, it's not pulling or tugging. I'm going to take this, keep it below the bladder, put it on part of the bed that does not move. So this is attached to the leg. I'm going to make sure that the bag is closed. Okay, I will clean up. Okay, so then I would throw all this into the garbage. I would take my gloves off. Okay, I would get her comfortable. Cover her up. I would note how she tolerated it. I would ask her if she has any questions for me. I will put the bed back down. So I will also note the drainage that is coming out, the amount, if I see any blood. I will then thank her for her time. If she has any problems, go ahead and use her call light, which is over there. Make sure she's comfortable. I'm going to leave. I'm going to wash my hands. This isn't in the picture anymore. Okay, so now I'm going to remove the catheter. Okay, so I'm going to knock, come in. Hi, my name is Rhiannon and I'm with Highland Community College and I'm a student. Today's the big day. You get to get your catheter out. Do you have any questions for me? If she doesn't have any questions, I would go wash my hands. I would come back, put some gloves on. I would have supplies with me to do peri-care. Okay, and I'm going to raise the bed up. I would actually make sure that the order says that she can have the catheter DC'd. Okay, and she's at my comfortable level. Of course, I would have looked at her armband, had her say her first and last name, pull the curtains. If anybody was in here, I'd ask them to leave at this point. Okay, so then I would uncover her. We're going to take it out now. Okay, and then I would have the nurse help me, because this would be attached to her leg. Have her bend. I would do my peri-care. Okay, and then the one thing that we have to look at is how much liquid did we put into the balloon, so that way when we know that it needs to come out, we know how much water needs to be pulled out of that balloon so we don't cause any damage. So being that I know that I put the catheter in, she had 10 cc's. So I need to get 10 cc's out of that balloon and then I can take it out. And this is not sterile, this is just clean, so after my pericare. You want to make sure that you will have a pad here, because when I do pull it out, some liquid may come out. Okay, so I want to make sure that I get that 10 cc's of liquid. Okay, there's my 10 cc's. Okay, now I'm going to ask the patient to just take a little deep breath, and I'm going to pull it out slowly. And as I pull it out, remember liquid might come out, grab it, and make it all drain into the bag. So then I am going to drain this and then put this into a red biohazard bag. But I'm going to note how much is in here, color, odor, amount, and I will also put in there that the patient tolerated it. Okay, so then I will put this in the red bag. Remove my gloves. I will clean her up. Well, actually, I will get another pair of gloves. Clean her up. Actually, let's just do it, because my gloves were contaminated. So here I would wipe up any urine that has leaked out. Okay, and then I would let her get comfortable. Ask her if she has any questions. I will put the bed down for safety. I will make sure that she has her call light. Okay. All right, so if you have any questions, problems, I'd like you to push that call light. So then I would take my gloves off, thank her for her time, wash my hands, and then I can leave the room.